What's going on, everyone? Happy Thursday to everyone. Hopefully, everyone is doing well, staying safe and healthy. If you had to take a COVID test, hopefully you have tested negative. And if you did test positive, hopefully you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, August 3rd, 2023. Yesterday, I received a lot of comments on my well being and how I was feeling. I wasn't feeling the best yesterday. One of my long COVID GI issues came back yesterday with chest pressure. I can report to you so far today, it is better. Is it 100% better? No, but it's better than it was yesterday, which is telling me that whatever causes it, whatever the episode is, I'm coming out of it. So therefore, I do not need to call a doctor and have a doctor's appointment during this time of rising infections. Alrighty, let's get into today's update with India. India today reports 77 new cases. Their cases are slightly starting to rise, and they're not rising rapidly, but like I've been reporting on, they're just bouncing off the bottom. However, now they're bouncing up a little bit higher, and today is 77 new cases, and a good signal of that is the active cases. 1,533 active cases. That is up from 1,474. Now we must remember something, because I'm about to show you something here, if I can find it within the article. They're talking about, here it is. Scientists believe that COVID-19 virus has become largely inactive, attributing to its mild nature and the wide immunity developed across the entire population due to widespread infection and vaccination, and so on and so on and so on. Okay, yes, these are low numbers, but India really significantly undercounts on cases, deaths, hospitalizations, ICUs, all of that stuff. And we know India is a big country, and we are starting to see it rise. So whatever rise we're seeing now, it's likely higher than what we know about. By the way, their death toll is now at 531,918. All right, this is interesting. We're just going to read a headline. Fungus that causes valley fever, a pneumonia-like illness, is expected to sicken more people, a study said. That's not good. So another illness that is going to be going around, as if we don't have enough illnesses out there. It's another one now that we have to concern ourselves with. And speaking of concerning ourselves, Washington County Jail sees an increase in COVID-19 cases. More than 40 Washington County detainees test positive for COVID-19 in July. So this is not good to see. This is, I believe, in Arkansas. A lot of states have a Washington County. The Washington County Jail is seeing an outbreak of COVID-19 cases. This comes as the jail saw an increase of 40 new cases in the month of July. On average, the Washington County Jail sees 1 or 2 positive cases each month. So, yeah, that's a big increase. And let's see what this says. We started seeing an increase in the first part of July, but we have a congregate setting. We have nearly 800 people packed into a pretty small space. So it's not unusual to see COVID, said Jay Cantel, the sheriff for Washington County. It seems to come in waves, and yeah, they're in a wave right now. Alrighty, moving on to this. First was COVID. Now China is facing an Mpox crisis as cases spike. Yes, Mpox, formerly known as monkeypox, is starting to rise again in China. And it says between the week ending in May 5th and the week ending in July 21st, 315 cases were reported. Now you're saying China has 1 billion people. Yes, they do, but any cases is interesting to see, because remember, the WHO declared the monkeypox emergency over. Alright, now today's silly news. We don't usually have a silly news segment, but I consider this to be silly news. Nose picking. Yes, you know, this thing. It's disgusting. Alright, this is disgusting news, we'll call it that. Nose picking health workers more likely to get COVID, study shows. Let's go down here and find out what this is all about. Healthcare workers who pick their nose, that's just nasty. Okay, no one should be picking their nose. But now you work in healthcare and you're picking your nose? Come on. That's not right. Healthcare workers who pick their nose are more likely to get COVID and should be made aware of the infection risk, a study suggests. Of 219 participants, 17% of those who admitted nose picking tested positive for COVID, compared to 6% of those who did not pick their nose. Okay, so someone actually did a study. They actually called up and said, "Hi, we're conducting a study. We just want to know one thing. Have you had COVID?" Well, why, yes, I did have COVID. Are you someone that usually picks your nose? Wait, what? Pick your nose? Well, yeah, I guess I have done it before. Okay, that's all I want to know. So you caught COVID and you do pick your nose. Interesting. Thank you for joining our survey. I mean, really, that's what it sounds like to me. It says men and younger people were more likely to admit to the habit they found. All right, that's enough of this study. Let's move on. It's Thursday. That means we have a new update out of Ohio. Ohio COVID-19 cases up for fourth straight week. Coronavirus update for Thursday, August 3rd. And Cleveland, Ohio. The number of new COVID-19 cases reported in Ohio climbed for the fourth week in a row. 2,054 were reported last week. We had that number here on the pandemic update last Thursday. At least I believe we did. And this week, it's higher. 2,666. And we do have some new wastewater numbers today that do back this number. So, yes, this is not good to see. We come down here. I do believe we have some more data out of this. Yes, we do. Total reported deaths, 42,437. That's up by 9. Total hospitalizations is up by 50. 141,425 since the pandemic started. ICU admissions are up by 9, but I'm not seeing active hospitalizations. Or is it here somewhere? Yes, it is. Here it is. The number of COVID-19 patients in Ohio hospitals rose from 132 reported last week to 141 reported this week. So even the hospitalization number is starting to creep upward in Ohio. Alrighty, let's take a look at the air quality, and some bad news report here. Air quality is not so great in many areas of the country. I'll just start off here with the good news. The Four Corners region is not too bad. The West Coast and the Pacific Northwest, while you do have some good areas mixed in between, we are seeing a lot of bad areas. And look up in Canada. For our friends, we do have people that follow me from Canada. I'm sure I do. Yeah, it's generally poor air quality, even as if you go far north. I mean, the wildfires have not stopped. Some of that's starting to come back down into the Great Lakes region. Parts of the Northeast, parts of the Southeast. The I-95 corridor is not doing too great with air quality. It's cloudy here now in Philadelphia, but this morning before the clouds moved in, we did have a haze in the atmosphere. You can see, New Jersey, the air quality is still not that bad, but look what's just to the west here in Pennsylvania. I saw it moving in this morning. I mean, it's not that bad, but it was noticeable in the sky. You could see the wildfire smoke once again, and until we get some more relief up north, which I don't have the graphic here, it's on my weather tabs, but there is some heavier rain that's coming into the northern plains, so that is going to clean your air a little bit. Unfortunately, what we need to happen is we need that to shift further north up into Canada to stop these wildfires from continuously sending smoke down into the United States, and that's going to take some time. If you want to learn more about the weather, which we just talked about, I do have another channel called @Climate Data Report. The name of the channel is Climate Data Report. I give a weather forecast daily. Eventually, I'm going to start featuring some more climate data from around the world. We just don't get enough time in the day to do that. Right now we just do a forecast video. Eventually, trust me, we're going to get some other stuff in there because that's the name of it. The name of it is Climate Data Report. We talk about weather, we talk about all things climate. We basically try to raise awareness about the extremes, how one place can go from a drought and quickly go to a flood. It's happening, it's real, it's legit. Alright, moving on. We know that Walgreens this week, let's refresh this. We know that Walgreens this week, the positivity did rise in the United States to 42%. Prior week was 38.8%. That's a difference of up 3.2%. Total tests, 1,922. The prior week was 2,028. I do believe we still missed a few states this week. Colorado, 37% positivity. Prior week was 35.7%. That's up 1.3%. Total tests, 27 versus 14. Let's come out here and take a look at Missouri. Missouri is at 18.2%. Prior week was 39.1%. That's down 20.9%. Total test, 22 versus 23. So that's a legitimate drop. And I forgot to say, it's a legitimate rise in Colorado. Let's just do one more. How about Georgia? What's going on there? 40.5% positivity this week. Prior week was 47.1%. Difference of 6.7%. Total test, 84 versus 70. That is a legitimate drop, at least on Walgreens data. Alright, we have to show you BioBot Analytics. Here's the long-range view. Let's move in a little bit. Aha, look at this. There is definitely a rise, and we're seeing the pace starting to pick up in the Midwest. And that is, Ohio does definitely supports this in Ohio. We'll take a look at Ohio wastewater sites on our weekly wastewater update, which will come out Sunday. And taking a look here, you can see here, all regions of the United States are continuing to rise. The only one that has leveled off a little bit is the Southeast, and in the summer months, the Southeast does tend to peak in August, so they've had a sustained rise. Now we'll have to see if that peak actually happens. Maybe they're going to slow down and start going higher again. You know, we saw that across the nation last year where we saw like this, up and up and up and up. It would peak, and then it would not go as low as last time, then it would go higher. You know the deal. And the West Coast is still rising, but the Midwest, the Great Lakes region, that's really concerning because it is picking up the pace, and not much of a slowdown in the Northeast, and not much of a slowdown in the West Coast. Taking a look at the wastewater sites on the CDC, there's no update here, but just note, we're still watching these moderate and high sites. We'll have to see if that continues to rise this week. And we come here to ER visits. I don't think that's updated yet. No, it still has not updated yet, and you know the deal here. There's only 3 New England sites that are not rising, and there's just a few other sites in the country that are not rising, and Puerto Rico has not reported, but stay tuned. Stay with this video. We got a little surprise for you later. I shouldn't say surprise, but something we haven't looked at in a long time. Alright, we have to do this day in COVID history. I'm going to move myself to the left. And August 3rd, 2021, amid a growing surge of the Delta variant, CDC Director Rochelle Lewinsky signs, she's the former CDC Director now, by the way, signs an eviction moratorium in areas of substantial and high COVID-19 transmission in recognition that eviction moratoria like quarantine, isolation, and social distancing can be effective public health measures taken to prevent the spread of a communicable disease like COVID-19. That's this day in COVID history. Now how about some more current COVID news? Well, this will get an update tomorrow, so it's not the most recent, but tomorrow hopefully we get an update on the variants, and we do know that XBB.1.16 is dominating at 14.8%, and EG.5 is there at 11.4%. We'll have to see. Maybe a new variant will be dominating tomorrow. We'll just have to see. Only time will tell. Alrighty, now let's take a look at a few of those wastewater sites that detect other things, not just COVID, but flu, RSV, you name it. And today, I think it would be proper if we start down here. How about we go down to the Maryland, like near the Chesapeake Bay? What's going on there? Hollywood, Maryland. The population at this wastewater facility in St. Mary's County is at 55,000. So this does not include, remember, private septic tanks or private wastewater treatment facilities, you know, people who are not connected to a sewer system. COVID was rising. Then on the most recent update, it dropped a little bit. Influenza, not an issue. RSV, not an issue. HMPV, not an issue. Mpox, not an issue. Norovirus is there, but it is dropping at this time. And we're just going to do one more wastewater site because we do want to get the hub up and their data. And how about today we come down here near the Mexico border in Texas and we see what's going on there. And here, this population at this watershed in Webb County is 120,000. Look at that. Coronavirus continues to rise on the most recent update, which was July 31st. That's not only 4 days ago. Influenza, not an issue. RSV, not an issue. HMPV, not an issue. Mpox, not detected. And norovirus is dropping at this time. Wow, norovirus is almost down to zero. Not quite, but almost at zero. So that is good to see. All right, we do want to take a look at Hubbub and their Data Hubbub World. And let's see here what we have this week. And I can tell you the highest areas are in Southern California, down in Florida. New Orleans is one too. Look at that. Wow. We'll have to look at Louisiana today. And right here along the I-95 corridor in the Northeast. We're not going to do every state. We're just going to do a few states. A few of the most concerning states. Let's start off with California. You can see for COVID, there's a high area down by Los Angeles. Another one down by San Diego. 45 contagious people within a 5-minute walk. Flu, not really much of an issue. RSV, not much of an issue. Influenza-like illness is an issue at 21. Then you come up here to the Bay Area, and we do see some higher amounts, 38, 47. So that is not good to see. Let's go to another state. How about we take a look at D.C.? Whoa, 26 contagious people within a 5-minute walk for influenza-like illness. RSV, 2 within a 5-minute walk. Flu, 2 within a 5-minute walk. And COVID-19, up to 24 within a 5-minute walk. Now let's take a look at Illinois. Illinois is most concerning for COVID, everything in the Chicago metro area, but influenza-like illness, there are a couple areas in the southern portion of the state, closer to Missouri, like by St. Louis, that are relatively concerning. All right, let's come down here. We do want to take a look at New York State. This is very important. And New York State for influenza-like illness. New York City is super concerning. But it does look like it dropped a little bit. We're seeing an area of 403 contagious-like people. There's another one here, which is at 31. Then you have 115, 236. So, yes, there is definitely some infections to be found. Let's take a look at COVID. Let's see what the COVID numbers are. Whoa! 1,596 people within a 5-minute walk. Wasn't expecting to see this higher than influenza-like illness, but it is. Then you see another area of 870, 482, and not too many concerns in the rest of the state. Couple smaller concerning areas in the western portion of the state. Flu, not much of an issue. RSV, not much of an issue. Let's go back to influenza-like illness again. And there's a couple more concerning areas in the western portion of the state. Let's take a look at New Jersey. That's actually going to be the next piece of data we look at. And New Jersey is most concerning as you get closer to the area of New York City metropolitan area. All right, coming down here, we do want to take a look at Louisiana. Where's Louisiana? We do want to see Louisiana because it looks like New Orleans area is getting concerning. Yep, we do see 34 and 25 and 10 contagious people within a 5-minute walk. Flu is not terribly concerning. However, there is some flu prevalence down there in New Orleans area. RSV, a little bit of prevalence as well. Influenza-like illness, highest in Louisiana. And let's end this on Florida, shall we? We do want to take a look at Florida. Look at that. Florida, you can see, it's a general mixture of moderate to high prevalence. RSV, yeah, there's some concerns near Miami. Flu, not a big deal. And COVID is highest down by Miami. And generally along the I-95 corridor and the I-75 corridor and the extreme western portion of the Panhandle. So there are quite a few concerning areas. Jacksonville doesn't look to be doing too bad. I shouldn't say Jacksonville. Tallahassee does not look to be doing too bad right now. All right, let's get our update on New Jersey. 229 hospitalizations. There, 22 people in the ICU. Let's move myself back to the right so we can click on ventilators. 7 people on a ventilator. Discharges is at 47. Alrighty, moving on now. It's time to get an update out of Philadelphia. 723 EMS incidents last 24 hours. For yesterday, this is yesterday's total. That is an improvement. It's dropping. These are some of the lowest numbers we've seen in quite some time. July was a busy, busy month for the Philadelphia Fire Department, but there were quite a few fire incidents last night. Not liking to see that, or yesterday, I should say. Montgomery County, It's been a busy day there today. I know it's only 11 incidents right now, but trust me, when I was out doing some orders, I had to deliver a catering order at lunchtime today, and I saw multiple ambulances, and in one spot, there's a roadwork uh, section that they set up daily, and the ambulance was stuck trying to go through the roadwork zone. Then I saw a second ambulance coming through there. I mean, that's never good to see. Chester County has been relatively busy today, and yeah, that looks to still be the case right now. Emotional disorders, respiratory difficulties, strokes, multiple strokes, heart problems, another respiratory difficulty. It's overdoses. Ooh, a bad day in Chester County. And earlier, it was up to like when I came back and looked at my computer screen, I said, whoa, there's 17 calls in Chester County. That was like around 1:45-ish. So a little better now, but still a busy day there today. All right, New York State. Let's refresh this to make sure this is the current number. Yeah, I thought it was because I updated it earlier. 829 new cases. Positivity is now 11.6%. 7-day average is 10.3%. And I mean, look at some of these various different regions. Schenectady, 20%. Columbia, 25%. Livingston, 50% positivity. If you live in Livingston, New York, and you're feeling sick right now, please go get tested. That positivity is ridiculous. What's going on in Yates County? One person tested, one person positive, 100% positivity. That's just ridiculous. I don't even know where Yates is. Does anyone know where that is? Let me comment. Let me know in the comments down below, or I'll just Google it when I'm done today's video. That's got to be in a very rural area of New York where people do not bother to get tested. And let's refresh this. We do want to take a look at the hospitalizations. And some slight good news to report on this today. Not a big increase. It increased slightly, but with that does come some bad news. While the hospitalizations did not increase, gotta zoom this in even more, because there's a point I'm trying to make across here. Alright, now I went overkill. There's a point I'm trying to make across here. While the hospitalizations did not go up all that much, say 649, we are starting to see a small increase in ICUs. On July 31st, they were at 58. Today, they're up to 67. They are starting to go up, not much, but it's something noticeable. It's something to take note of. Keep that in the back of your mind that there is a small increase in the number of people in the ICU in New York State. Taking a look at New York City, you can see in New York City, same deal, but a little differently. The hospitalizations did drop in New York City today, but the number of people in the ICU, it's now up to 28. It was at 21 on the, or 22 on the first update of the week. So hospitalizations down ever so slightly in New York City. That's actually a good thing. All right, we got Texas to update yesterday, and the update out of Texas yesterday was 9,326 new cases. That's slightly down from last week, which was 9,476. And the hospitalization situation did increase by 61. 748 versus 687. Fatalities dropped by 8. 7 versus 15. And now moving on to something we have not looked at in a very long time. And that, my friends, is Puerto Rico. We want to see what the data is in Puerto Rico. So on August 2nd, 5,757 tests were added. New cases reported yesterday. Wow, 1,220 in one day. Hospitalizations are at 157, and 13 people are in the ICU. On August 1st, they reported 9 deaths. So it looks to me, take a look at this. I don't know how accurate Merdiva is. That's the source I'm using here. But look at this. I'm just going back here. They do update pretty frequently. So I think we're going to go back to reporting on Puerto Rico daily. We'll just use these numbers. If these numbers are significantly off, someone let me know down below. I know there may not be enough testing. Testing may be lower, maybe an undercount. But the point of this is we can still report on Puerto Rico. And that makes me happy. Anytime I find something else that we can report on, that's a good day in my book. All right, we do want to take a look just at a quick international update. Then we're going to end this. I know we're almost at 25 minutes long. Around the world, cases are down 27%, deaths are down 31%. Brazil, cases are down 21%, deaths are down 30%. Canada, cases are down 25%, deaths are up 38%. Canada doesn't do much reporting on their cases. what I'm saying is they don't test enough. They do not test anywhere near enough. The Philippines, cases are down 28%. Deaths are up 90%. 57 deaths versus 30. That's not good to see. Bolivia, 7% increase in cases, no deaths reported. Chile, 52% increase in cases. And then we come down here to Switzerland, 11% increase in cases. Vietnam, cases are down 24%. And let's just do one more. Norway, cases are up 13%. Deaths are 2 versus 5. That equals to a 60% decrease. Alrighty, folks, that does it for today's pandemic update. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know someone that needs a wake-up call about the pandemic, and maybe they're just nagging to say, oh, come on, it's fine. You can come out and do this. You won't catch COVID. COVID's over now. It's not a big deal anymore. Send them to my channel. By the time they watch one of my videos, they'll see, wow, I didn't know COVID was still a thing. I see that quite often, where someone will post on social media saying they tested positive, and they say, for real, you got COVID? You got the COVID? That's still a thing? Yes, my friends, it's still a thing. So yeah, send them my way. And again, thank you yesterday for all the comments about my well-being. Again, I'm feeling much better today. Not 100%. And you know what? Even just to be safe, I've done this so many times in the past, I'll probably COVID test this evening. Why not? You can never be too sure of what might be COVID. We've seen various different things turn out to be a COVID infection. I don't think it is a COVID infection, but you can never be too safe. Alright, everyone. Thanks for watching. I'll see you all again tomorrow for the next pandemic update, which will include, hopefully, the variant proportion update as well. Have a great evening, everyone. I'll see you all again next time. Until I see you again next time, stay safe, everyone.